Hello everyone, Dr. Ryan Shakley here, your Annapolis chiropractor. Today I wanted to address a common misconception that I hear a lot in the office, and it has to do with muscle tightness. Every day I have people come in and they tell me, Doc, I've got this muscle tension, this muscle soreness, this muscle tightness, but it's not a chiropractic thing, it's just a muscle problem. And my questions for them usually are, how long has this issue been around for, and how often do you have it? And the answer I usually get is, well, it's there all day long. It's there every day. And it's been around for days or weeks or months or sometimes even years. And my response to that is, muscles don't tighten up by themselves. They can't do that. So if you don't believe me, buy a steak, put a steak on the counter and wait for it to contract. It just doesn't happen. It has to be a neurological response or a chemical response firing that muscle and making it do what it's doing. We've all overworked a muscle or overstrained a muscle doing something, and it's tight and tender and sore for a day or two, maybe 3 or 4. But if it goes on longer than that, what is actually happening there is the brain is actually automatically controlling the muscles. It's telling them to tighten up to restrict your movement and to protect an area. If you have 2 vertebrae that shift out of position, they pinch a nerve, that muscle will spasm up around that, and it's to limit that motion and to keep you from further damaging that nerve tissue. The same thing happens in a shoulder and a knee and these other structures of the body. If something is biomechanically not functioning well, if it's not moving properly and it's going to cause further damage, the brain will automatically tighten these things up to try to give it support, to give it help, and to try to keep you from further damaging that structure. It's very smart. So when we go in and we take things like a painkiller, we take things like a muscle relaxer to knock down those symptoms where the body's trying to protect itself, what you're actually doing is allowing these problems to worsen. If you take a muscle relaxer and you force those things to relax and release, it's going to allow that to biomechanically function improperly, and it's going to cause a continued breakdown. When you're taking, non-steroidal anti-inflammatory drugs, what you're doing there is you're taking away that inflammatory response of the body trying to limit you and tell you to stop. But what a lot of people don't realize is that affects the internal organs, puts a larger strain on them. And non-steroidals actually also shut down proteoglycan production. What that means is the body uses those proteoglycans to basically support the cartilage, support the meniscus, to support those softer tissues in there. And if you shut down the production, that actually causes an increase in the breakdown of those structures over time. So if you're taking those things for days or weeks or months, and sometimes people even years, as I mentioned, you're actually causing that to continue to break down, actually making things a lot worse. So what do you do about it? You fix the underlying problem. You go in, you identify why this structure isn't working well, you correct it, and you get the muscles to support it and not protect it. You're basically just restoring proper biomechanical function in there. The way we do that in the office, you come in, we go through, we do a full workup. We're going to look at you head to toe, inside and out, and figure out the entire problem going on under the surface. I had a patient that came in the other day with a shoulder and carpal tunnel issues, and they were so laser focused in on just the carpal tunnel and just the shoulder that they missed the bigger picture of some neck problems, some mid-back problems, and an underlying condition of the muscles tightening up to protect that whole area. So we've got her started, we've got her going in the right direction now, and in a few weeks she's going to be doing a lot better. So if you or one of your family members or a loved one knows someone that's having one of these issues or sees that or is just curious about it, give us a call at the office. We'll get you in, we'll go through, we'll do a thorough workup on you, evaluate you, and see if there's some underlying condition. We love helping people avoid the use of drugs and surgery, especially when they're poor options in these cases, and there's something you can actually do to correct that. Many times I have people going in and getting sometimes some physical therapy or getting some surgery or one of these things done, and the problem just kind of keeps coming back over and over and over again. Well, we can still help those people even after having all that work done, because all we're going to do is identify why that keeps coming back over and over and address the actual issue. Okay, and that's really the key, is go after the cause of things. Don't just chase down a bunch of symptoms, because it's a never-ending loop. It's a vicious cycle, really. So if you think we can help, give us a call at the office, 410-263-4171. We are more than happy to help. You can visit us at the website, check things out there, www.shakleychiro.com. We're going to post this video on Facebook and also on our YouTube channel, so feel free to subscribe to that. That'll keep you updated on all of our recent posts, and follow us on Facebook as well. And other than that, I hope you have a wonderful weekend, and I'll talk to you next time.